Hi everyone, Daniela here from the Obstacle Doc, and today we're going to talk about avoiding bowel and bladder habits. And by avoiding, I mean peeing and pooping. So a quick little anatomy recap for us, just so that we understand why this is important. If I take out my bladder and my colon, you can see here the deepest third layer of the pelvic floor. It does run like a hammock from front to back. It also goes side to side. If you look at it from the external surface, we have a urethral sphincter, an anal sphincter, and a vaginal canal if you have a vagina. All of these muscles that you see through here, when they contract, they are closing around the canals. So they are closing the sphincters, if you will. And when the muscles lengthen or relax, they're going to open the sphincters. So in theory, when we're on the toilet, when we're trying to go to the bathroom, our goal is to lengthen or relax those muscles as much as possible so that they're not closing down the sphincters. Rather, they are going to open those up. So a couple ways that we can try to do that. The first is positioning. So this is a 16-inch box. Most toilets are going to run from either 14 to 17 inches high. Just depends on where you are, but that's true for the states. This is a squatty potty. So a squatty potty, what it does is it gets your feet higher off the ground so that your knees are at a bigger flexion angle with your hips. So I'm a little bit taller, if you will. When we use a squatty potty, what we want to think about is getting as much effort out of our body as we can while we're on the toilet. Going to the bathroom should be more or less effortless. Again, if we're using muscle, we're probably contracting around those sphincters, which is not what we want to do. I'm going to put my pelvis down. So you want to get your feet higher than the ground so that your knees are higher than your hips. And now we're in a bit of a tilt forward, if you will. What this is going to do is this is going to, first of all, relax where there is almost a kink in your colon. And it's going to get you in a more optimal position for a bowel movement. That does not mean that it's not also effective for your bladder. Again, reason being, all these muscles are doing the same thing. So if we can improve our bowel movements, we can improve our bladder movements. So when you get your feet up, propped up, it doesn't have to be a squatty potty. You can get a box. If you have a child, you can use your children's stools if they step up to the toilet. And then the most important piece is that you lean forward. So again, we're trying to get as much relaxation through your body as we can so that pelvic floor can also relax. The second thing we want to make sure we're doing every time we're on the toilet is breathing. So diaphragmatic breathing is going to increase your intra-abdominal pressure. That's through here. And it gives a natural movement to the pelvic floor in the lengthening position as air comes into the system. So holding your breath, big no-no when we're on the toilet. We want to keep breathing. A, it's helpful to the muscle, but B, it keeps you more comfortable. And then the third very important thing we're going to try to do while we're here is not push. So pushing or straining usually activates the muscle. Again, we want to get as much relaxation out of those muscles as possible. So if you are trying to push or strain and you're like, oh, well, everything comes out faster, think of a hose, right? If you have a hose and you put your thumb over the top of the hose, it seems like things comes out faster, but it's really just a change in the pressure. So getting as little activity as you can through the pelvic floor is actually going to help all of those muscles open and let things come out a little bit more naturally. So first is going to be getting your feet into an optimal position. Second is going to be breathing. Third is going to be not trying to do any pushing or straining. And then the last trick you can do if you feel like you're either not emptying totally or you think there might be still something left that needs to come out, you can always stand up and sit back down. This is helpful, A, because it kind of resets your mind, resets your body. But once you stand up, you're kind of engaging those muscles. When you sit down, you might relax again. So that's always an easy trick. The most important thing to remember is not to sit here for too long. And by too long, I mean because you're trying to get something to happen that maybe isn't ready to. So if you've been on the toilet for more than 5 minutes, not because you're scrolling on Instagram, but maybe just because you're trying to get something to happen, go ahead and get up, leave, go for a little walk. If the feeling strikes you again, then come back. but don't sit here trying to make something happen that isn't ready to.